Now underway at the White House, a meeting between President Obama and Health and Human Services Secretary Sylvia Burwell. Nationally, enrollment for the Affordable Care Act has topped about 9.9 million consumers, which the administration says beats its goal of 9.1 million. Doug McElway live at the White House with an update. Doug?
Hi, John. The White House has been pretty vague on today's meeting with HHS Secretary Sylvia Burwell, noting that she tends to visit the White House quite regularly, once a month or so, to keep tabs on the implementation of Obamacare. That said, the White House has been very keen to tout the advantages of Obamacare, as the president did yesterday in his town hall meeting in Des Moines, Iowa.
We've helped more than 16 million people have the security of health insurance, many of them for the first time.
Critics say don't let those enrollment numbers fool you. There are some big-time battles being fought both within the administration and outside of the administration over skyrocketing premium rate increases, which the administration wants to try to limit. Take a look at some of these numbers, some anticipated jumps in health care premiums for next year. First, the 5 states with the highest premium jumps for next year: Alaska at 39%, Oregon at 24.2%, Kansas 23%, Iowa 22.3%, and Idaho at 20%. And now the 5 states with the lowest premium increases anticipated for next year: Washington State at 4.2%, New Mexico and California at 4%, Connecticut at 3.5%, and Indiana with no premium increases. The fear of more rate increases is very well founded. Last July 22nd, the Kaiser Health Network had an article about how the administration was trying to find ways to limit these increases by encouraging people to change their health care plans. It said, quote, "Insurance industry consultant and frequent Obamacare critic Robert Lazowski says that forcing people to change their plan in order to avoid huge increases is just one problem of many. Quote, this is a debacle. This is a blow-up. This is a mess," he said. There's big trouble in Obamacare land. The biggest carriers are losing their shirts. In the coming election year, Obamacare is a hot issue for GOP candidates. Premium increases are red meat to one candidate. We're talking about Donald Trump, who spoke about it last night at his rally in Dallas.
Obamacare, we're going to repeal it, we're going to replace it, we're going to get something great. Repeal it, replace it, get something great.
Trump has been very vague, though, even silent on many of his policy prescriptions. He, of course, announced his immigration plan. He plans to announce his limited tax plan, simplified tax plan, I should say, in the next couple of weeks. But with Donald Care, which he's encouraging his voters, his supporters to call it, he has been very vague, other than the fact that he wants insurance companies to be able to compete across state lines. But that's roughly it in terms of his policy prescription for an alternative to Obamacare. John, back to you.
Maybe we'll hear more specifics down the road. You'll bring them to us, I'm sure. Doug McElway at the White House. Thank you.